As it has been virtually every night since February, our lead story tonight is the coronavirus outbreak. The headlines only grow more worrisome. Today, the World Health Organization officially calling it a pandemic. Literally, the whole world is talking about this outbreak. None of us is unaffected by its impact. As anchor of this broadcast, I want you to know we're focused on bringing you the facts and trying to answer the questions on your minds. The last thing we want to do is unnecessarily alarm people. But this is serious stuff, and we are going to continue to follow this story wherever it takes us. And with that, let's start with Steve Patterson in hard-hit Washington State.
Tonight, Washington State taking extraordinary measures to slow the spread of coronavirus.
The decisions that we're making today and the decisions we probably will be making in the upcoming days are going to be profoundly disturbing to a lot of the ways we live our lives.
The move, called mandatory social distancing, would ban gatherings with 250 people or more in 3 counties, an area affecting 4 million, meaning no crowds at sporting events or even large church and community gatherings. Officials also asking residents to cancel elective surgeries to free up hospital resources if possible, and asking local businesses to aggressively change how they operate by allowing employees to telecommute.
This is an order. If somebody is consciously avoiding it, there are measures to have legal means to stop that from happening.
What are the penalties exactly for not abiding by the ban?
The penalties are you might be killing your granddad if you don't do it. And I'm serious about this.
Today's order also bans gatherings under 250 people unless the organizers follow strict public health guidelines, including providing adequate sanitation and regular health checks. He says it's the most effective way to slow the spread.
The slippery slope that I'm worried about is having 60,000 people be infected in mid-May and 2,000 deceased.
Colleges throughout the state have already canceled classes. Tonight, Seattle Public Schools announcing closures through the end of the month.
I think probably it's almost too late.
Aggressive measures at the epicenter of the U.S. coronavirus outbreak.
Unfortunately, we know that the rest of the nation will be where we are perhaps in a couple or 3 weeks.
Steve joins me now. Steve, Seattle hospitals tend to be ranked rather high. How are those hospitals doing right now with the loads they're seeing?
Lester, the hospitals here are taxed with a record number of patients and now 370 confirmed cases, and that number is doubling every few days. And so the governor is hoping his actions today serve as a template for the rest of the country.
All right,
Lester.
Steve Patterson, thank you. The number of confirmed cases in the U.S. surpassed 1,000 today, but there are growing questions about whether enough people are being tested to truly know the extent of this disease. Here's Miguel Almaguer.
Officially declaring a global pandemic, tonight the World Health Organization says it's deeply concerned by the alarming spread of the coronavirus and the levels of inaction to stop it.
We have rang the alarm bell loud and clear.
Here at home, a new benchmark as the number of confirmed cases soars over 1,000. The doctor who serves Congress expects up to 150 million people in the U.S., or 45% of the population, could contract the virus. Experts say the death toll will climb.
Bottom line, it's going to get worse.
With multiple states announcing their first cases today, a fight is underway over whether there are enough tests for the general public.
The president on March 6th told the people in my district publicly that the tests were ready. There were no tests. Zero.
We have always been able to meet the full demand for test orders from public health officials.
In Georgia, Clay Bentley showed flu-like symptoms more than a week ago, but wasn't tested. When his condition worsened, he returned to doctors and learned he has the virus.
If I had took care of it when I first told them that I had a problem, we could have done away with it at the front.
Across the country, communities are taking different measures to contain the illness. Morgan Radford is in New Rochelle, New York.
This is the nation's first containment zone. Starting tomorrow, schools and other large organizations within a 1-mile radius will be closed for 2 weeks.
New York City is now disinfecting public transit twice a day. San Francisco announcing a ban on all mass gatherings with over 1,000 people for the next 2 weeks. The Golden State Warriors confirming they will play without fans tomorrow night. Now all 3 weeks of March Madness will also be closed to the general public. For the NBA and NCAA, a first in history. Extraordinary steps in place to protect the public. Tonight across the nation, uncertainty, anger, and a growing level of anxiety. Just a short time ago here in Los Angeles, and the typically busy streets of Hollywood are fairly empty tonight. We have our first confirmed death in LA County. Officials in this state also say multiple TSA agents have contracted the virus, and there is now talk of restricting crowds in this major U.S. city. Lester.
All right, Miguel Almaguer, thank you. The anxiety reflected once again on Wall Street, the Dow closing down almost 1,500 points on the day. Tonight, President Trump will address the nation in prime time. Our Kristen Welker is at the White House.
Tonight, with coronavirus cases mounting, President Trump says he will announce new steps to address the crisis.
I'll be making a statement later on tonight as to what I've decided to do and what our country will be doing.
The president saying he is looking at the possibility of new travel restrictions to Europe, as well as possibly declaring a national disaster, which could free up as much as $40 billion in federal funds, something the president seemed to hint at earlier in the day, tweeting, "I am fully prepared to use the full power of the federal government to deal with our current challenge of the coronavirus." The administration has also been working with House Democrats on a plan to help Americans impacted, including expanding paid sick leave, lunches for kids in need, and bolstering unemployment insurance.
If we get rid of the problem quickly, everything solves itself. We don't need stimulus, so that'll be good. But we are talking about various forms of stimulus.
All of it as top health official Anthony Fauci told Congress to brace for a bigger battle.
And things will get worse than they are right now. How much worse we'll get will depend on our ability to contain and mitigate within our own country.
Also under serious consideration, extending the April 15th tax filing deadline. The Treasury Secretary saying that move could put more than $200 billion back into the economy. Lester.
All right, Kristen Welker at the White House, thank you. We mentioned hospitals in Seattle a moment ago. Across the country, though, hospitals really have no choice but to prepare for worst-case scenarios, with some health experts questioning whether the system is ready to treat a flood of patients if that's what this eventually comes down to. Here's Tom Costello.
And remember, the testing plan is to keep the individuals away.
In the Incident Command Center at Johns Hopkins Medicine, they're preparing for a sudden surge of patients who need immediate care. Today, big news.
We have our in-house tests that our microbiology colleagues have developed.
Hopkins now approved to conduct its own coronavirus test, no longer reliant on the CDC. For months, Hopkins' coronavirus website has been tracking real-time every case worldwide. Like all hospitals, it's now ensuring it's ready. Enough beds, medicine, ventilators, protective clothing, and personnel. One big challenge, planning for a scenario in which doctors and nurses, hospital staff become sick and then need care themselves.
We are on the front lines.
Today, nurses in several California cities complained their hospitals aren't prepared. Some hospitals now setting up tents to screen patients outside before they enter the ER. The concern? An onslaught of patients could push the nation's medical system to the breaking point, unable to care for patients with other conditions, too.
We have a finite number of ICU beds and a finite number of ventilators, and there's only so much we can do to augment that capacity.
Experts do believe that more than 80% of those who contract the virus will experience mild symptoms.
Just because you have coronavirus doesn't mean you need to be in a hospital.
Absolutely. In fact, that really isn't where you should be unless you have severe symptoms or have some kind of medical emergency.
The goal now, say experts, slowing the spread of the virus so hospitals aren't overwhelmed with patients all at once. Tom Costello, NBC News, Baltimore.
Our chief medical correspondent, Dr. John Torres, is with us. One of the many questions we keep hearing, if I think I need to be tested for the virus, what are the steps?
And Lester, this is not like a flu test where you see your doctor, get the test, and the results all in one visit. For COVID-19, the first step is to talk to your doctor to determine your risk. If you have symptoms, have traveled to a high-risk area, or had close contact with a patient, your doctor is likely to request the test. If none of those things are true, well, your doctor probably won't recommend it. In some places, though, the doctor still needs to get approval from the local health department. If approved, patients get the test, which is a swab up their nose and down their throat, but test results can take a few days.
A lot of good information there, Doctor. Thank you. We'll be back in 60 seconds with the growing pressure on schools as more colleges cancel classes and resort to teaching online. Also, the impact on business. What about the people who just can't work from home? As the coronavirus spreads, more than 100 U.S. colleges have now announced they are suspending in-person classes. But is our higher education system really set up to move online? Gabe Gutierrez looks into it.
At Kent State University, today many students moved out unexpectedly.
What are you taking with you?
Everything.
The school is suspending in-person classes after several coronavirus cases were confirmed in Northeast Ohio. Starting next week, all classes here will be taught online.
It was kind of chaotic and everyone was like, is this actually real?
I think it's a little overreactive, but I get what they're trying to do.
Residence halls will stay open for students with no place else to go, but already campus is deserted. Here's what it looked like in the fall. This is now.
Is higher education prepared to migrate mostly online in just a short time?
You know, that is the $1 million question. I think personally this coronavirus COVID-19 experience is really pushing the envelope for institutions of higher education to think about the ways in which we offer the academic experience to students.
It's an effort to protect not just young people, but the more at-risk faculty and staff. Across the country, more and more schools are doing the same, an unprecedented move, transitioning millions of students to online classes in just a few days.
It's not enough time to really be as effective as you would like to be, but under the circumstances, you have to triage in some ways.
For many campuses, more unanswered questions. What about students whose courses require lab work? Will those who leave be reimbursed for room and board? And what about graduation down the line?
What if this outbreak gets worse?
You know, we're taking that one day at a time.
The list of universities now suspending in-person classes through at least spring break continues to grow as school administrators grapple with difficult decisions longer term. Lester?
Life as we know changing in so many ways. Gabe, thank you. And with hundreds of thousands of people already taking classes and working remotely, it is having a devastating impact on small businesses. Here's Stephanie Rule.
Deborah Miller started her catering company 24 years ago.
How's everything going?
Most orders are for corporate food services, like office lunches. So the push to work remotely is hurting business.
People are not flying in from out of town for meetings. Offices are just closing up.
Fewer corporate orders means less money to pay her 30-plus employees. Right now, how many people are working today?
I think about 6. It's a challenge. I mean, we've had to send people home.
Can you do your job from home?
No, I can work from home. I'm a cook. I do my work here in the kitchen.
Working remotely is not an option here. And there's the underlying stress of providing a living wage for longtime staff.
It's painful for me to think about these families that I'm responsible for.
A responsibility business owners don't take lightly, especially in the service industry.
That's good information.
Where working from home is not an option.
I don't want to lose clients and I don't want to lose barbers.
At Denny Moe's Barbershop, clients are canceling.
I looked at my schedule and I had 17 clients, and when I got to work, I only had 5. My fear is that these doors won't open and the people won't come through.
A concern for many of America's 30 million small businesses.
We are honestly more worried about what's going to happen to the business than we are about catching the virus.
At the Nest, most exercise classes were at capacity just 2 weeks ago. Now they're hovering around 40%.
People are definitely worried about staying home and being around other people.
Worried about staying afloat.
I'm on a roller coaster.
For their businesses and their employees. Stephanie Rule, NBC News, New York.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.